Hello everyone, this is Clarissa from DNP Mentor. A little bit about me for those of you that don't know me. I am a California family nurse practitioner and psychiatric nurse practitioner. I have been a nurse practitioner since 1998. And really the goal of this channel is to provide education and mentoring for other nurses, students, or new mental health providers that are seeking just ways of increasing their knowledge. And for that, I want to provide mentoring. But it's also for individuals that are suffering with mental illness that maybe are looking also for ways to improve their symptoms or to gain more knowledge about their illness as well. And with that, I'll get started with today's presentation. This will be anxiety part 2. I did part 1 about a week and a half ago, and I'm a little bit late in actually filming this second part. I've been busy with other things. I also want to be able to put up some of my old assignments when I was a DNP student. And so I went ahead and posted 3 of those. I was a student at Brandman University, and I did complete the DNP program May of 2020. And so for those of you that are students that are in that program, I'm going to go ahead and be posting in the weeks to come all of the video presentations that were part of the school assignments and also the signature assignments. So stay tuned also for information on anxiety part 2. Today I'm going to be covering how to manage anxiety without medication. And part 3 will be medication management. But let's rewind a little bit and sort of, if I could explain a little bit of what anxiety is and what causes it. When we go into the treatment part of it, it'll make sense as to why the treatment might work. The first thing is, of course, anxiety is sort of like that emotion or thought of things that haven't happened. So it's that anticipation. It's the what if. Now, one of the things that I always want to make sure that people understand is that anxiety is a liar. And so it's going to give you thoughts of pending doom. It's going to give you thoughts that might cause some negative emotion or some worry. Okay, so the first thing is recognizing that anxiety lies. And so if I'm getting a thought of, oh my God, this person isn't home yet, I wonder if they were in a car accident. And so as I'm recognizing this and I'm getting that sort of that negative emotion, that panic or that negative feeling, as I'm getting that, anytime that I get that feeling, it's to recognize it. Wait a minute. This is anxiety. Let me think about that thought again and say, okay, I'm worried that this person hasn't come home yet because they might be in a car accident. Now, has this ever happened before? No. Is this likely? No. Is it possible? Yes. But is it likely? No. And so now what happens is we're retraining the brain to be able to pick up some of the distorted thoughts so that down the line we can sort of try to change this automatic thought. So the first thing is recognition. Now, recognition and knowledge don't always lead to change of emotion. So how do we try to change that emotion that comes with the anxiety? So the first thing, awareness, knowing that potentially it isn't true and potentially it doesn't belong. Now, when the anxiety moments happen, it would be a good idea to plant our feet on the ground and just scan the room a little bit and know, right now I am safe. Taking a deep breath, having that awareness that, okay, it's a thought. Now I know emotions lie and I know anxiety lies. So let me go ahead and see what I can focus instead, or what can I do that will generate some endorphins that will help to sort of feed the right emotion into my brain so that I can have a different emotion. And so one of the things that you can do is some relaxation techniques. And there's actually a science behind that. So I like to teach people to focus on their pressure point. So it could be a pressure point, say in the wrist. And so take a moment as you're grounding yourself, press on the pressure point of your wrist. Just feel that sensation. Be in tune, not to the emotion that you feel inside, but to the emotion of feeling the pressure on your wrist. Take a moment, put some pressure, about 30 seconds, move on to the next side. And as you're starting to focus, the brain, what happens is it will begin to loosen some of the thoughts that you were maybe preoccupied with, and you're focusing on that. Practice that. Then you can do other pressure points. An area would be the other side of the elbow. There's also shoulder and knee, about 30 seconds each side. You go through that. Now that's one of the things. Now, another important technique, and probably the most crucial in my mind, would be the deep breathing. And the deep breathing is more than just deep breathing and distraction. What happens as we are telling our brain to slow down, so we are taking a deep breath, holding it in and letting it out. So the brain is getting the signal, wait a minute, you're thinking too much, slow down. So what happens, it begins to try to help us. And so guess what happens then? Endorphins could be released. And so that will be a game changer automatically. There's a lot of scientific-based information that talks about deep breathing. There's a very special technique called 4-7-8. And with that technique, the idea is to take a deep breath through your nose that will last for 4 seconds. You hold it for 7 and you let it out for 8. So in for 4, hold it for 7, let it out by 8. And you do have to practice. Now what happens with this, something special happens, and it happens more so if you practice this technique over time, because there is a concept called neuroplasticity, and that's a big word. But that is actually your brain sort of developing new areas or pathways so that the flow of information can go around an area. And so with that, we build more synapses, more ways of the brain responding, and that happens over time, so that in fact will also hopefully lead to a decrease in anxiety, because those are not the automatic thoughts that you get. So a lot of science behind this again. So deep breath for 4, hold it for 7, and then you let it out through your mouth by 8. 2 of these repetitions twice a day automatically, whether you have anxiety or not, would go a long ways in trying to establish and create that neuroplasticity. So that's a homework that I'm going to give you. If you don't mind looking that word up, and you're going to find out a lot of information that goes along with that. And if you want to learn more information about neuroplasticity from me, then go ahead and link a comment below, and I will be happy to do a little bit more research on you. But I don't want to just bore you with a lot of information. I want to give you practical information of things that work. The last thing that I want to cover today in terms of dealing with anxiety is also the idea of exercise. And exercise, again, it's not just a mere distraction or something to do, but again, when you exercise for 20 to 30 minutes, you create endorphins, and the endorphins are good chemicals that will go up to the brain, and guess what? They will feed your brain sensor a different emotion. If you could do some exercise pretty consistently every other day, because the endorphins last for 2 days, pretty routinely, and I'm going to challenge you to try this for 2 weeks to see if that actually makes a big difference. I hope that this information today was useful, and I hope that you will join me next week for another video on anxiety part 3. And then also for the students, if you want to stay tuned, and also if some of my assignments will be helpful. Thank you for watching, and I hope you have a good afternoon.